Imagine you've planned a vacation with your partner and your kids to the beach. You've been working upwards to 50 hours a week, feel as though you need a break, and decide to piece together the perfect getaway for you and your family. However, once you get there, things don't seem to go the way that you planned. The kids would rather play video games instead of going on your deep sea fishing adventure that you booked 2 months ago. Your partner wakes up late, and therefore your whole day is off balance. You spent more money in souvenirs than you have allotted, and work keeps calling you for answers. You're at your breaking point, you want to cry, and end up bottling yourself up, creating this obvious tension between you and your family. If this feels all too familiar to you, then I have some information that might be able to help. First, we'll talk about OCPD, what it is, and the symptoms. Second, we will discuss the difference between OCD and OCPD. Then we will gather information on how to support someone you know or love who has OCPD. And lastly, we will discuss 3 treatment options for those with OCPD. What is OCPD and what are the symptoms? According to the book Interview Guide for Evaluating DSM 5 Psychiatric Disorders and Mental Status Examination by Mark Zimmerman, the definition of obsessive compulsive personality disorder is a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency beginning in early adulthood. One must have at least 4 of the following symptoms for this to be considered a diagnosis. Number 1, preoccupied with details, rules, lists, order, organization, or schedules to the extent that a major point of the activity is lost, such as everything that I described in the introduction. All of those things coming together, all the planned activities, your partner waking up late for the schedule, you lost your point to the vacation. You're upset and you lose the point of having a vacation, which is to relax. Number 2, you show perfectionism that interferes with task completion. Number 3, you're excessively devoted to work and productivity to the exclusion of leisure activities and friendships. Again, in the intro, you work 50 plus hours a week and work keeps calling you and you don't know how to relax. You're obsessed with overproductivity. Number 4, you're overconscientious, scrupulous, and inflexible with matters of morality, ethics, or values. Number 5, you're unable to discard worn out or worthless objects even when they have no sentimental value. Number 6, you're reluctant to delegate tasks or to work with others unless they submit to exactly his or her way of doing things. Number 7, adopts a miserly spending style towards yourself and others. Money is often viewed as something to be hoarded for future catastrophes. Again, in the intro, you're upset because you spent more money towards souvenirs than you allotted. And number 8, shows rigidity and stubbornness. Gary Trusclair, licensed clinical social worker and psychotherapist, in his OCPD blog helps describe the difference between OCD and OCPD. OCD has more specific obsessions and compulsive behaviors such as washing your hands, cleanliness, and intrusive thoughts. OCPD is actually the most common personality disorder, affecting about 7.9% of the population. OCPD affects the entire personality, dealing more with perfectionism and the need for control, and can have a more negative effect on relationships than OCD. According to Zimmerman, OCD compulsions are more anxiety-based, whereas OCPD is more personality. How to support a spouse or partner with OCPD. Catherine Watson writes in her article, Obsessive Compulsive Personality Disorder, OCPD, that most OCPD patients aren't even aware that there's anything wrong with the way that they think or behave. They often believe that their way is the correct way and everyone else is wrong. My way or the highway. Trusclair's blog has 3 steps to try to encourage your relationship with someone who may have this disorder. Number 1, perspective. Your partner wants to do the right thing. If they're mean and unyielding, it's often because their anxiety is high. Insecurity can cause them to be defensive. Work, perfection, control, and rules can actually be a way to protect themselves from hurt and shame. Do what you can to lower their anxiety. It may lower demands. Ask yourself if you play any role in their anxiety. And reflect on whether you've allowed a situation to develop where you allow them to do most of the work or take on most of the responsibility just because it's easier for you. And this wouldn't be intentional, obvious, or conscious on your part at all, but it still may be part of the problem. Appreciate what they do well and let them know. Notice what about them contributes to the relationship. Oftentimes, they are very loyal. They are very reliable and they are extremely hardworking. Second step is communication. Reassure them that they don't have to be perfect and kind of point out how it might be hurting them. Tell them the effect that they have on you with an I statement. They may not be aware of the effect that they have on you or other people. Ask them to go to couples therapy, encourage them to go to individual therapy, and set appropriate boundaries. Step 3 is self-care. Partners of people with OCPD often have a sense of being dominated by them. If you can recognize that it's actually their anxiety that leads to their need to control and that they actually need what you have to offer them, you might be able to forge a more equal partnership. Reflect on your own personality style. If you're easygoing, a people pleaser, or submissive, it might make it more difficult to be equal. Remember that they have a need for love and connection with you. There's something that that you have that they lack. Could be humor, sensitivity, or the ability to loosen up and go with the flow. Protect yourself with family, friends, groups, and a therapist. Sometimes these relationships just don't work, and you need to protect yourself with your own support system. According to Watson, there are 3 main treatment options for OCPD. Number 1 being cognitive behavioral therapy. You talk through the anxiety, stress, and depression with a counselor, and this is the most used one. Number 2 is medication, an SSRI or selective serotonin reuptake inhibitor or an antidepressant like Prozac. And number 3 is relaxation therapy, yoga, tai chi, Pilates, learning how to relax because they are often very uptight and don't know how. So first, we learned that OCPD is and what its symptoms are. Next, we learned the difference between OCD and OCPD. Then, we were given several steps to support a loved one who has been diagnosed with disorder. And last, we listed 3 treatment options. Now that you know more about obsessive compulsive personality disorder, you can be better prepared to understand and support those with this mental health disorder.